You might be choosing the wrong medical specialty, and it's going to cost you 4 years and $500,000 to figure that out. Here's what nobody tells premeds. Your specialty choice could start now, not just in medical school. And I'm about to show you a framework that'll reveal which specialty matches your personality, the shadowing strategy that'll confirm your choice, and how to use these decisions and insights to strengthen your medical school application by 300%. The prestige trap. Okay, let's meet James Smith. He was a Harvard undergrad, had a high MCAT score, and was a published researcher. He was convinced he'd be a neurosurgeon since age 16. He built his entire application around it, and honestly, he was very successful. He shadowed neurosurgeons, did neuroscience research, and wrote about saving brain trauma patients in his personal statement. Now, fast forward to his 3rd year of medical school, he had his first neurosurgery rotation. Then the reality hits. He had 110-hour weeks. He learned about the 7-year residency program. He realized that the average age of his first real job was gonna be at 35 years old. The divorce rate was high, 73%. And he watched attendings miss their kids' birthdays, sleep in call rooms more than home sometimes, and operate for 16 hours straight. Okay, so where is James now? James is now a dermatologist. He makes a lot of money too. He works 40 to 45 hours per week and actually sees his family plenty. But I guess just to look at everything in retrospect, he kind of wasted 3 years building the wrong narrative, doing the wrong research, and shadowing the wrong specialists. The prestige trap catches most premeds. Premeds choose specialties based on TV shows, societal respect, or what sounds impressive at family dinners. Here's how to avoid the prestige trap. Calculate the real ROI or return on investment. Take the average specialty salary and divide by actual hours worked. For example, dermatology, you make $440,000 at 45 hours weekly, which equates to $187 per hour. And then let's compare with neurosurgery. A neurosurgeon makes $780,000 at approximately 80 hours per week. Guess what? That's also about $187 per hour. So these two doctors have the same hourly rate, but vastly different lifestyles. Okay, so what should you take away from this? Learn about the reality and the specialties you're interested in, and don't just accept the glamour at the surface. Don't just watch surgeries, shadow the paperwork, the 3 a.m. calls, the insurance fights, and the potential difficult families to work with. Ask doctors about their bad days. Get the perspective of 3 burned out doctors in your dream specialty. You could find them on Reddit's residency forums or SDN, or maybe even YouTube. And then ask these doctors, what would you tell your pre-med self about your specialty choice? Their answers might shock you. And finally, you could take the personality specialty alignment test. The big 5 personality traits might predict specialty satisfaction better than interests. You love multitasking and thinking on your feet? Well, emergency medicine sounds right for you. Write 2 personal statements or letters to yourself, one for your current dream specialty and the other for a lifestyle specialty. Which feels more authentic? Which experiences do you actually want to have? The hidden curriculum reality. Here's what most medical schools won't tell you. Each specialty has a hidden curriculum that starts in undergrad. I call this the specialty pipeline framework. Picture medical specialties as exclusive clubs. Each club has unwritten rules about who gets in, starting years before you apply to residency. Orthopedic surgery, they want Division I athletes or individuals with military backgrounds. Why? They value physical stamina and team hierarchy. What about psychiatry? That specialty favors humanities majors with therapy experience. And then there's the dermatologists. They love research publications. I know. These characteristics are like stereotypes. But now that I've been in the medical field for over a decade, I think there is some truth to these stereotypes. But seriously, please think about what each specialty's job demands. If you're planning to pursue surgery or any medical specialty that requires procedures, but you have zero manual dexterity, you're not really choosing the right specialty. Likewise, if you're planning to go into psychiatry but only have hard science experiences, your application looks pretty inconsistent. What should you do as a pre-med? First, research the hidden requirements. Go to residency program websites. Look at current residencies' bios. What experiences appear repeatedly? Look for those patterns and make a checklist. Second, audit your current activities. List everything you're doing. Rate 1 to 10 for specialty alignment. Anything below a 7 needs some reconsideration or reframing. And then once you've figured all of that out, add one specialty-specific activity this month. Interested in surgery? Join makerspace or pottery for dexterity. Interested in pediatrics? Volunteer at a children's hospital. Interested in radiology? Learn something about image processing and analysis. And then, once you complete the activity, write one paragraph connecting your experiences to your specialty interests. Can you tell a coherent story? If not, you need more aligned activities. Create specialty-specific shadowing goals. Don't just shadow randomly. I would target 100 hours in your chosen specialty. That way you really see the good days and the bad days and what this specialty is really about. And I always push and believe in the importance of exploration. Strive for at least 20 hours in 2 related specialties just for comparison. The PRISM decision method. So, how do you actually choose the right specialty sooner rather than later? You need the PRISM framework. Think about choosing a specialty like buying a house. Most people focus on curb appeal or how impressive it looks from the outside. But you have to live inside that house every single day for 30 or 40 years. The granite countertops won't matter if the foundation's cracked or the neighbors don't really fit your lifestyle. So let's begin. P is for personality. Does your temperament match that specialty? And specifically, are you going to be happy with the work-life balance? Some careers, like emergency medicine or hospitalists, have overnight shifts too. Some specialties require 80 hours per week, while others just expect 40 hours a week. R is responsibilities. Can you actually handle the daily task? And do you think you'd like the day-to-day? In general, there are procedure specialties and non-procedural specialties. I is for income. Does the financial reality work for your financial goals? S is for schedule. Will you have the lifestyle and schedule that you want? How long will it take for you to actually get the schedule that you want? M is for mission. Does the specialty align with why you entered medicine? Let me show you PRISM in action. Sarah was very extroverted and agreeable, perfect for primary care's constant patient interaction. But she also valued financial independence and work-life balance. PRISM revealed her match. Urgent care medicine, patient interactions without continuity burden, a $300K salary, no call schedule, and the mission of accessible healthcare was fulfilled. So, how could Sarah become an urgent care medicine doctor? She could be an adult or pediatric urgent care physician. The routes to work in urgent care include pursuing pediatrics, emergency medicine, internal medicine, and family medicine. So this is pretty cool because she has options, but she's also narrowed it down to 4 specialties. Sarah could now shadow all those specialties and see which one she loves the most. Now, let's run your own PRISM analysis. Personality assessment. Take the Big 5 test specifically calibrated for medical specialties. Match your traits. Openness suits psychiatry. Extroversion matches emergency medicine. Agreeableness aligns with pediatrics. List the top 10 daily tasks for your specialty of interest. Rate your enthusiasm from 1 to 10. Is the average below a 7? Well, maybe that's the wrong specialty for you. You could find this data again on YouTube's, like watch Data Life videos or specialty association website. And of course, shadowing and talking to doctors too. Okay, next, I, income analysis with the debt factor. Calculate average specialty salary minus loan payments divided by the hours worked. That's the actual hourly value. include opportunity costs of training length. So a 7-year neurosurgery residency at $60K could mean $1.4 million less earned than other specialties. Audit your schedule and energy throughout the day and week. Track your current energy patterns for 2 weeks. Are you a morning person? Surgery starts at 5 a.m. Are you a night owl? Well, emergency medicine needs you, just like me. Do you need your weekends? Avoid OB. Do you want predictability? Then maybe choose pathology or radiology. And finally, do the mission alignment test. Write why you want to be a doctor in 1 sentence. Now, match it to specialty mission statements. Pediatrics, advocate for children's health. Oncology, fight cancer with cutting-edge treatments. What's the strongest resonance? To summarize this whole video, the specialty you choose now shapes the next 40 years of your life. Remember, picking the right specialty isn't about prestige or money. It's about aligning your authentic self with your future daily reality. Which specialty will let you thrive, not just survive? Drop your thoughts in the comments below.